Hello, everyone, and welcome. Welcome to wherever you're tuning in from. A huge welcome to you. I'm Grace Leary, and welcome to this episode of the Carnosine Q&A. Tonight, we are brought with Dr. V across all platforms. So if you're watching on YouTube, Instagram, or Facebook, please drop a comment right now and tell us where you're tuning in from. I'm a busy mum of 5, and my personal mission in life is to maintain peak health and vitality as I age, so I can keep up with all my kids as they age. If you want to age better and feel better, then you are definitely in the right place during this discussion. A huge welcome to those that are catching the recording later on. This is an important disclaimer that I would like to share. The content of this session is provided for educational and informational purposes only. This is not intended to serve as professional medical advice, diagnosis, or treatment. So please always seek the advice of a qualified healthcare provider with any questions you might have regarding a medical condition or before starting any new supplement or treatment regime. I have a special video to introduce Dr. Villarreal. He is a longevity medicine expert, and he helps his clients in his Houston clinic reach their highest potential through cutting-edge personalized medicine. And he has included in his protocol this incredible gel that we are here to talk about tonight. Welcome, Dr. Villarreal. That was a great little intro.
Yeah, how was that? That's pretty cool.
Very cool. Well, cool is what is happening in the world of carnosine. And you're bringing yourself to the forefront of this incredible molecule and really leading the way as one of the experts that are just talking about this and educating the world on its benefits. So how does that feel to be, an emerging carnosine expert because of what you found?
Well, I just fell into it. I was introduced to it about a year ago. I was an early adopter, and right away I saw that the science was really, really sound. But it wasn't until we started to have more and more patient experiences with it that I just, started to take a deeper look. And it has just been amazing just to introduce it into practice. And, in the beginning, we were kind of sparingly using it for certain, patients and athletes. And now it's pretty much used across the board with everybody. But I mean, it has been amazing. And I'm looking forward to a lot more of the clinical studies that are being done right now, specifically with Lactigo. Okay. There's a ton of studies on L-carnosine itself. And even if you look at the studies where there's a few of them that say they didn't see a benefit or whatever, well, that was also because they were using the oral L-carnosine. So this is what separates the Lactigo. So we're real excited about all the benefits that it's providing to all our patients and athletes. But yeah, look forward to really delving into a lot more of the modality, the reasoning, and won't get too sciencey. We can, but that's going to be more for conferences like the one we're having that I'm excited to be speaking at in January, and we'll be doing deep dives for patients, because there's a lot of mechanisms of action as to how L-carnosine and even the magnesium. A lot of people are forgetting that there's a powerhouse magnesium in it as well, but it is had amazing benefits to all our patients.
Well, it's so exciting just knowing that there is all this research. I personally am not one to read the papers, but I love the confidence that so many health professionals are looking at this and going, wow, this is a miracle molecule. Could you just kick us off by giving a simple breakdown of the science behind Lactigo that everyone's talking about at the moment, and specifically what's in it and why does it work?
Yeah, great question. So I will keep it simple. because I can tend to go off. I get real sciencey. I can get real geeky with it. But basically, Lactigo, it's built around two naturally occurring compounds that your body already uses every single day, and it's L-carnosine and magnesium. L-carnosine is basically a dipeptide found in high concentrations in muscle, brain, connective tissue. One of its main jobs is to buffer acidity and calm stressed tissue. When muscles or joints are overworked or inflamed, the environment becomes acidic. It pumps out a lot of hydrogen ions, becomes acidic. That acidity is one of the biggest triggers of pain and fatigue. Carnosine, basically, it helps neutralize that acidity and also stabilizes irritated nerve endings, which is why many people feel relief within minutes of applying it. Carnosine also has really powerful anti-inflammatory, antioxidant, anti-glycation properties, meaning it helps to protect the tissue from oxidative stress and stiffening and damage that can occur over time with aging, injury, and chronic inflammation. The magnesium, like I was talking about, a lot of people, were focused on carnosine, but it has a very potent magnesium sulfate in it, which is pretty much the same magnesium that you see in like Epsom salts. That's why people take like some relief, Epsom salt baths, because you absorb magnesium sulfate like directly through the skin. But magnesium in the Lactigo, it complements the carnosine perfectly. Magnesium helps to relax muscles. It calms overactive nerves, and it blocks excessive like pain signaling. It also plays a really critical role in energy production, muscle recovery. Magnesium is delivered directly to the tissue with the Lactigo, so it can reduce nerve excitability and muscle tension really, really quickly. And the big thing is, why does it work so fast? Because Lactigo, it's topical. It's completely bypassing the problem that we've always had in the past with carnosine. We have specific enzymes, one specifically called carnosinase, or you can remember CN1, that, when you apply it topically, it completely bypasses the gut and the bloodstream and delivers these compounds directly to the target tissue and the nerve endings that are irritated. So that allows for kind of rapid local effects instead of waiting hours or days for any kind of like oral or for any kind of buildup with an oral. Basically, in short, Lactigo, it works by calming pain signals, reducing acidity, inflammation, relaxing muscle tissue, and it protects joints and connective tissue, all using compounds your body already recognizes and knows how to use. Your body knows how to use carnosine, is just depleted. After the age of 20, it rapidly depletes. So it's something that we had a lot of when we were younger, and we tend to, deplete the older we get. And that's basically the science. And, if you have any like specific, questions, I have more and more and more like patient experiences every single day. But if you have any specific questions, I'd be happy to answer them.
Amazing. Thank you. So there's questions about carnosine and AGEs, which is advanced glycation end products.
Yep.
Not many people know what this means, but a search found that there's a huge amount of research that's been going on, a total of around 187 articles on PubMed, just searching carnosine and AGEs. So carnosine studied for its anti-aging benefits. Could you explain this in a simple way, what AGEs are and how carnosine, and specifically Lactigo, is helping?
Yeah, so the simplest way I could explain it is AGEs, it ages you. It is the main thing that causes the wrinkling of the skin. It causes a stiffening of the arteries. It causes a lot of like cognitive and neural, what we call mild cognitive impairment, or MCI. It can cause a lot of just a lot of pain and inflammation. We joke about this, but anybody that is over 40, over 50, maybe now even 30, but for sure over 40, over 50, like we can go to bed and wake up sore and feel like something happened to you overnight, like somebody beat me up overnight, and you wake up sore and don't even know why. And even more so if you're active and you're hiking or you're lifting weights or you're doing, any type of, extreme sports like CrossFit or now High Rocks and some of these other ones. But AGE is the simplest explanation is what ages is one of the, and it comes generally just from diet, lifestyle, high sugar diets. That's why there's a lot of metabolic crossover. And that's also why, we can talk about it later, but there's a lot of metabolic crossover with the Lactigo as well. But yeah, there's a lot of mechanisms and evidence on how Lactigo actually reduces AGEs. The majority of the studies are on carnosine reducing anti-glycation end products. So the number one way it works, and again, I'll try not to get too sciencey, but it reacts with what we call reactive oxidative species or reactive carbonyl species specifically. Basically, this is a core and repeatedly demonstrated mechanism in all the biochemical and cell studies. It has antioxidant, free radical scavenging. There's studies on metal chelating activity of carnosine. So there's also, not just advanced glycation end products, but, there's what we call metal catalyzed glycooxidation. I know it's a big word, but there's some studies that show that carnosine can bind transition metals that otherwise would catalyze into oxidative reactions, and they accelerate the AGE formation. So
just could you explain what is chelation?
Yeah, chelation is the body's ability to kind of gather any kind of toxins, any kind of metals and things, and then shuttle them out so they can be excreted. That's chelation. So for people that have heavy metal poisoning, we do chelation therapy medically. So we'll use specific compounds, either oral or IV, and that'll actually bind any of the toxins and heavy metals, and it'll shuttle it out and excrete it either in urine or feces. So, but specifically, you kind of mentioned the skin benefits. That is one of the biggest things, and there's a lot of studies on the skin benefits, and there's some big names in the cosmetic world that actually tried to buy Lactigo a year ago, 2 years ago, and specifically for its skin improving properties. There's a lot of topical evidence on it improving skin glycation or preventing skin glycation. There's human skin studies with topical carnosine, and they decrease markers. They showed markedly decreased markers of glycation and improved skin glycation biomarkers. So in other words, it helped with wrinkling of the skin, preventing wrinkling of the skin, improve collagen synthesis, and again, let's not forget. I mean, again, the superstar is carnosine, but magnesium also helps reduce AGEs as well. There's a lot of mechanisms, and a lot of them are the same, but a couple of them are different. So one of the big ones with magnesium is it actually can improve glucose metabolism and insulin sensitivity. So higher magnesium intake supplementation is basically associated with lower risk of impaired glucose regulation and type 2 diabetes. And these are direct, results from studies. Again, magnesium itself has the ability to reduce oxidative stress and inflammation downstream. And there's a lot of emerging, data on, more, because we just started learning over the last few years about AGEs. Okay. And it's kind of a hot topic, but if you look at it, there's a lot of studies on it.
I've read that it can be likened to rust.
Mm-hmm. Yep. Absolutely. Yeah. So that's another easy way that you can think about whenever you hear oxidation or oxidative stress, or think of iron, like iron rusting, like the inside of a pipe rusting. That's the easiest analogy that you can use for that. But I mean, like I said, I speak to this like I'm trying to, kind of bring it down so everybody, because there's going to be people that want to be real sciencey, and there's going to be people that just, hey, just tell me how it works. Just tell me what I need to do. And, because when a person comes in or a patient comes in, I'm not going to sit there and go, oh, this is for your anti-glycation end products. But you have a couple of those that want to know. But for the most part, they're hurting. They need something. I have something that'll help. And I'll explain kind of at a base level what it is. But the rust that you just discussed, it's a very important concept. So the simplest way, again, I'll try to simplify it, is basically AGEs are proteins in our body that have been damaged by sugar. That's it. That's the easiest way that we can, identify AGEs. AGEs are what happens when sugar sticks to proteins and essentially rusts them, to your point. Just like metal rusts when it's exposed to oxygen, proteins get damaged when they're exposed to sugar over time. That's the process that's called glycation. It happens naturally, but it accelerates with aging. It only gets worse as we get older. With high blood sugar, so if somebody has prediabetes, diabetes, insulin resistance, inflammation, if we have a lot of inflammatory, if you have a lot of rheumatoid arthritis, autoimmune conditions, things like that, you're going to have higher damage in AGEs and just overall like oxidative stress. When sugar attaches to a protein, whether that protein is in your joints, muscles, skin, nerves, blood vessels, that protein becomes stiff and inflexible. So that's why it like hardens the arteries. It loses its normal function. It triggers inflammation, which is where a lot of the pain comes from. And then it activates pain and aging pathways in the tissue. So it makes you age quicker. These damaged like proteins are what we call the AGEs. That's basically the simplest way to explain it at a lower level.
Amazing. That was really clear to me. So thank you. Mm-hmm. So for someone that's wanting to combat AGEs, oxidative stress, aging in general, and is really interested in longevity, how would they apply Lactigo?
Minimum twice daily. We're still coming up with protocols, but like what we've seen real world work is minimum twice a day. So either AM, PM. The sweet spot really for a lot of people, especially let's just say if they have acute pain, is going to be minimum 3 times a day. So if they show up with a lot of pain, and whether it's knee pain, back pain, any kind of pain, the relief actually happens pretty quickly, and we'll tell them to apply it as often. There's no upper limit to applying it daily. So the more that you apply it in the beginning, the quicker the buildup, and the quicker it starts to tamp down the neuroinflammation that's happening. And that's how, it really works. I mean, really, really, really quickly. It's not unheard of that, I mean, I can't tell you or show you how many texts or emails or just patient office visits where they just said, man, I didn't believe you when you said it worked that quick. Within 10 minutes of me applying it, like my pain was gone. And, that's literally why it happens. There's a lot of reasons why it happens, quickly, but anytime that we have pain, whether it's joint pain, whether it's just like sore muscles, literally you apply it and you get pain relief within minutes. Because remember, it's not a pain gel. It's not marketed, it's not listed as a pain gel, but we have a lot of pain relief within minutes of applying, or telling the patient to apply the topical Carnosine. So that itself is not coming from the anti-glycation or structural repair, but it's coming from like neuromodulation. So it's reducing the excitability of the nerves locally, the pH buffering, and there's a lot of local anti-inflammatory signaling that's happening.
Okay, thank you. Mm-hmm. We get questions around neuropathy, and you've mentioned that. So there's approximately 20 to 50 studies that have been published on PubMed on carnosine and neuropathy. Mm-hmm. Primarily peripheral neuropathy, including diabetic and chemotherapy induced.
Yep.
So that's the condition where the nerves are damaged, leading to symptoms like burning, pain, tingling, and numbness.
Yep.
Is for people that are suffering from this, could you talk about some of the benefits that carnosine and Lactigo may offer?
Yeah. So that is one of the biggest ones that we're seeing clinically is, that I see like directly with patients, and it follows a study. So it's not anything novel that we're doing. It's just following the studies. And the thing that we see immediately with carnosine or Lactigo is that there's rapid pH buffering. Okay. And basically they're acid sensing. So there's a lot of acid, they're called acid sensing nociceptors. L-carnosine is a really potent intra and extracellular buffer. So painful tissue, whether it's injured muscle, inflamed joint, fascia, becomes locally acidic. Just in general, anytime there's painful tissue, it becomes locally acidic. The acidic pH then activates pain receptors. The carnosine, it buffers these excess hydrogen ions that cause the acidity, and it raises the local pH, so they get relief really, really fast. And you get near immediate, like I said, pain relief, whether it's DOMS, like delayed onset muscle soreness, exercise-induced muscle pain, tendon irritation, joint capsule inflammation, just myofascial pain. But there's like direct modulation of like pain signaling. And we, again, like you can get sciencey, like in the ion channels, there's specific ion channels. We can go into all the, I don't want to go into all the receptors, but basically there's a very real mechanistic reason why the carnosine is doing all these things. But it's got, like, from a neuropathy standpoint, it's got anti-neurogenic, there's like anti-neurogenic inflammation response. So there's a lot of substances, is the easiest term, that like these nociceptors, when like you have peripheral neuropathy or restless legs or cramping, that are released. And the carnosine basically reduces the release of these, what we call neuropeptides. It dampens neurogenic inflammation, which is like the cause of the neuropathy, reduces vasodilation and edema or swelling, and it doesn't allow the pain to be amplified, so it reduces the pain amplification. So magnesium, again, is synergistic, right? So I know just, we continue to talk about the carnosine, which is the superstar, but I mean, again, you cannot, forget about like the benefits that the topical magnesium is also having, because magnesium, it blocks what we call NMDA receptors. It competes with calcium, going back to ion channel, it competes with calcium at the neuronal synapses. So that's where a lot of the pain relief comes immediately from the neuropathies. Relaxes smooth and skeletal muscle. Like that's why, people take, Epsom salt baths, right? And overall, if you remember, magnesium reduces nerve excitability. So anytime that there's like neuropathies, any kind of tingling, pain in their fingers or toes, like there's neuroexcitability. Okay. And so it'll reduce a lot of that neuron firing. And then on top of that, then the carnosine comes in and buffers any kind of the acidic pH that's causing the pain, and it stabilizes a lot of the membranes. So really, there's a lot of synergistic, fast-acting analgesia. So we, that's that's just a fancy term for like it's pain relief. So there's a lot of synergistic pain analgesia with the two.
Okay. And for someone that was wanting to experience these benefits, how would they go applying Lactigo?
As often and as much as possible. Like I had a patient to say today, so what do you want me to do? Like bathe in it? I'm like, if you can, yeah, do it. Like the more the better. Like you can't put on too much. And that's as any practitioner will tell you, we always need to look at anything that we use with a patient or a client as a risk benefit ratio, right? So if it has very, very, very high risk, probably not going to use it. It has low risk, high benefit, absolutely we're going to use it. so it clicks all those, checks all those boxes. Because I do not have to worry about any kind of medical interaction. I do not have to worry about, overuse. I do not have to worry about anybody with a contraindication. Like, there's nobody that can't use it because it's already magnesium and carnosine are naturally occurring in the body. So it's a no-brainer to use it. But yeah, it's there's never been anything like it, and I can't stress that point enough. We're talking about this like, it's the studies have been around forever, but it's important to point out that, because I get this from patients a lot, like, well, this is so great, how come I never heard about it? Because we've never had the delivery system that we have now, and that's what's going to set Lactigo apart over the next few years. Over the next few years, people are going to be hearing a whole lot more about carnosine, because now, as with any technology, okay, we have the ability now to deliver it directly to the target tissue. So all it takes is for somebody to try it, and that's why the hashtag is like, just try it, because we'll tell people like, hey, I could go on and on and on about the science. You just need to apply it, and once you apply it, we just have not had anybody that didn't. In fact, it's the opposite. In fact, people come back and say, man, I did not believe that I trust you. I believe you. I just did not believe that it would work as quickly as you said it was going to work. And that is the recurring theme. Just this past weekend, we had a close friend that I talked about him. He had come to see me, and he reached out to me on a Sunday afternoon, and he said, look, he goes, I already ordered it. I don't have any, but my wife has really, really bad back pain, and she's been laid up in bed and on the couch like for the last 3 days in pain. And today she's done. She's actually like, she's crying, and the pain is like unbearable. I ordered it. I don't have it. Do you have any at home? I'm like, sure, come by and pick it up. He came by and picked it up. He called me 30 minutes later, and he said, man, I've been watching my wife for the last 3 days in excruciating pain. And within 10 minutes of putting it on, she's walking around like nothing happened. And that is kind of par for the course for what we're seeing with the Lactigo. So that's why I'm excited to use it at every chance I get with every patient. My eyes actually light up when a patient says, man, I'm having this knee pain or this shoulder pain, or, I'm feeling great, but I have this, or I tweak that, and like, man, I got something for you. And they try it and it works.
That's wonderful. I love hearing your real patient results. We've got some questions.
Okay.
We've been asked over on our Instagram platform about carnosine's neurological benefits. So I've looked this up previously, and there's approximately 200 to 300 studies that have been published on carnosine and its potential neurological benefits. Mm-hmm. What are some of the experiences people are having with Lactigo?
Well, initially, a lot of people try it because they have something going on. We honestly haven't had people just like come to us specifically for the cognitive benefits, right? So initially when somebody uses it, they're using it for pain, they're using it for soreness, they're using it for something else. But with continued daily use, they all come back reporting, oh my God, like I feel better. I have more energy. I think better. I think clearer. And that's going to happen longer term. That's going to happen within not minutes, but like maybe, weeks to months, depending on what they have. But the weeks, we have been like having a lot of patients come in describing that they think clearer, they feel better. Overall, they just, and they can't like pinpoint it. They don't know what it is. They just know, hey, I started using it for my shoulder, and now all of a sudden, I don't have brain fog anymore. And, that goes back to, still a lot of the reduction of the inflammation that a lot of people have. Again, it's multivariable, because like at my clinic, like I'm working on them with their diet. I'm working on them with, their lifestyle. I'm working on, so it's multimodal, but all of them report, reduction in the brain fog. And that's huge, because you know, as a like when we talk about anti-aging, as an anti-aging, um, that's one of the main things you want to make sure you have, because you know, what good is your body if you don't remember who your kids are, or who you are, or you forget, you know, certain basic things. Your mind is one of the most important things, and unfortunately we have a lot of you know, things in our diet, lifestyle, um, that are working against that, from you know, from sugar to you know, prediabetes and diabetes, that you know, is leading to what we call type 3 diabetes, or you know, Alzheimer's. We're having medication induced dementia. I won't name what medication it is, but a lot of people that you know, um, that that are into health and wellness, they know what I'm specifically referring to, and I see a lot of it in my clinic. I see a lot of medication-induced dementia, that once you take them off certain medications, they return pretty quickly. But specifically from the carnosine, if you want to like talk about like specific studies, there's a ton of studies on the neuroprotective mechanisms of carnosine. Again, going back, all of them are going to kind of like, you know, follow each other, but you know, again, it goes back to carnosine being a potent antioxidant and reducing oxidative stress in the brain tissue. The oxidative stress in the brain tissue is one of the major components of age-related cognitive decline, um, and any neurodegenerative processes, whether that's something severe like MS or ALS, or something just like MCI, what we call mild cognitive impairment, which can unfortunately progress to like Alzheimer's, or you know, more serious things like that. But there's, you know, going back to the chelation of metals, you know, there's a lot of data on you know, metals increasing, you know, or metals causing neuroinflammation. And you know, there's a lot of studies on aluminum, you know, aluminum being one of the culprits, you know, for increasing what we call beta amyloid plaques and tau proteins in the brain, which kind of lead to Alzheimer's, or what are seen in a lot of Alzheimer's brains, or disease pathology. You know, these mechanisms are very well established in clinical evidence with carnosine, and it just takes somebody just like literally searching L-carnosine and L-carnosine and cognitive decline, L-carnosine and you'll get any number of studies. Specifically, you know, there's studies on it reducing the, like going back to the amyloid beta and the tau proteins that are, you know, high with Alzheimer's, and increase the neurodegeneration with Alzheimer's. So it supports neuronal and vascular health, and again, we could go on and on and on, but the studies are there. It's not, I mean, like I said, it's 3,000 plus studies minimum, and more coming, because luckily we have some funding, and they're funding lactigo specific clinical studies, and those will be coming out, you know, within this next year to 2 years.
Wow, we really are at the forefront of this.
Yeah.
And it's the delivery system which makes what we're doing with Lactigo even more exciting than what's already the foundation that's been laid.
Yep. So, and real quick, just to touch on that, if you do come across any clinical trial, just understand the difference. If you come across any clinical trials that show no benefit or minimal benefit, always look at what the mechanism of delivery was, because anytime that I have seen that, it is because they were using an oral carnosine, or they were using beta alanine, which is a precursor, to try to build up carnosine levels in the tissues, and that doesn't work, because we have that CN1 carnosinase enzyme, which is very high in the serum. But guess where there's no CN1? There's no CN1 in skin. There's no CN1 in muscle and, you know, other kind of fascial tissues. So that's why it'll readily absorb into the tissue. And so if you see any clinical studies that say, oh, no benefit with carnosine, and you want to, you know, look at the mechanism of what was used, because that's the only time that I've seen it not work, is when they use oral.
Okay, amazing. For anyone that's interested in healthy aging, having that longevity in their mind as well as their body for the neurological benefits, how would someone apply Lactigo?
What we have started recommending is to patients to put it on the back of the, if you're bald like me, I'll put it right on my head. I apply it right to my face. In fact, I still point back, and I'll never forget this conversation. Our chief science officer, Chad Macias, who's a genius. He was on a call with all of us, and there was this other doc on there that was kind of being there's a difference between being like skeptical and being kind of a jerk, and she was not being very nice, and she was a little bit beyond skeptical, but she was basically pointing out, she said, so you said that there's like neurological benefits, and so she's like, well, what do I do? Like, just put it on my head, and just plain as you can be, like Chad just says, yeah. and so, like, I mean, with me, no joke, like I put it, but honestly, if you put it on tissue, the more that you put it on, understand it'll go through the tissue into the bloodstream, and it has been shown, and you can look this up, it has been shown that the carnosine very, very readily passes the blood-brain barrier to impact neuronal health. Okay. It's already naturally found in the brain, and it was way more prevalent in the brain when we're younger, but its levels tend to decline with age. And there's some studies that show that it can preserve cerebral blood flow and brain structure. So, I would say if you want it for like cognitive benefits, I would put it as close to the brain anywhere there's kind of any blood flow. As we continue, remember that we've only launched October 2nd. So there's going to be a lot more specific application recommendations, protocols, things like that. But the easiest thing to do is just put it on the tissue, and it absorbs readily. If it's specifically for cognitive benefit, I would put it as close to the brain as you can. And especially if you put it on the carotids, I would say that it would absorb readily. But I mean, we see this all the time with like patients with headaches. My wife, she'll get these really bad, stress headaches where your neck tightens up. Literally, you can put that on, and within 5 minutes, her neck pain and her headache is gone, especially when it's a stress headache.
Amazing. Thank you so much for all of this information. It's a lot to take in for some people, but it just makes me feel so confident that the science is there. This is backed up, and it's very exciting what the future's going to bring. And really, it comes back to what you just said, which is you've heard about this gel that people are experiencing all these wonderful benefits. And the next thing to do is just try it.
Mm-hmm.
And the company does offer a 30-day money-back guarantee. So there really is nothing to lose at all. We just want more and more people to experience the wonderful benefits that other people are. So thank you so much, Dr. V, for your time and your expertise.
Thank you. Very hard to try to stay surface level and not try to get too sciencey, because I want to go into all that, but that'll be good for January.
Yeah, and it's good now, because what it's doing for me personally is building my belief. I don't have to understand it all, and neither does anyone on this call, but the fact that we can come to you and ask questions live with you about anyone that we want to share this with, and that's what the purpose of these lives are. So if you have any questions that you want answered in the next Q&A with Dr. V, please put them in the chat and we will get them answered. That's exactly what these are for. So we appreciate your high level of expertise and appreciate your time. Thank you, Dr. V.
Thank you. Thanks for having me on. Anytime.
Wow. Thank you so much, Dr. V. We're so excited. You will be able to meet Dr. V live at the Lactigo Science Summit, Rise, Build, Become. This is happening in Utah, January 16th to 17th of next year. So keep your eye on the Facebook group, the Carnosine Lab. Also, we're going to be back on the 13th of January with our next Carnosine Academy, and that will be featuring our Chief Science Officer, also molecular biologist, human performance coach for the US Navy SEALs. The list goes on and on. I'm talking about Chad Macias. So we will be back with him live in January. Merry Christmas, happy holidays to you and the people you love. And we really look forward to continuing on this legacy of sharing and educating people about the wonderful benefits of carnosine and Lactigo. Thank you and good night.